Good day, my dear undergraduate students. The topic for the day is Turner syndrome. It is a chromosomal disorder which can come as a short note or a few MCQs in the subjects of pathology, medicine, or pediatrics. Sometimes a compiled chart case can also be kept for the exam. The introduction. It is a chromosomal disorder wherein there is a non-disjunction. The chromosomes fail to separate, as a result of which one of the offsprings has got a defect in the number of chromosomes, leading to, say, the 45X chromosomes. Normally, the humans have got 46 chromosomes, that is 23 pairs. Here, one chromosome fails to come from the father to the offspring. Therefore, there is a non-disjunction, leading to a reduced number of chromosomes. Not as common as Down syndrome, but quite common. 1 in 2,000 to 5,000 live births. So, the female is there with a partially or a completely missing X chromosome. As I told you earlier, the defect is with the non-disjunction from the father's chromosome. The mother has got two X chromosomes, one of which comes to the offspring, whereas the chromosome from the father fails to come, as a result of which there is a defective X chromosome. There is no known risk, such as maternal age, etc. The child or the patient fails to develop the menstrual periods. Also, there can be presentation with visual and hearing problems. In some case, there can be what is called as mosaicism. Mosaicism means you find that there will be a play of chromosomes. Some of the cells will be having the normal chromosomes, 46XX, whereas others will be having 45-0X. These are the common presentations: delayed growth, short stature, and it is generally not diagnosed until adolescence or pre-adolescence. So these are the classical features of the Turner syndrome, which I think we people should be remembering. It is worth memorizing because any of these characters can be asked as a short note or rather an MCQ. And a student who is going to compile a complete list is definitely going to get more marks. We shall see how we can help you. The patient has got a short stature. There is a low set hairline. The shield-shaped thorax. And you find that the wide spacing of the nipple will be present. Also, you find that there is an increased carrying angle at the elbow, shortening of the metacarpal bones, and small fingernails. The facial features are also characteristic. There can be a fold of a skin that can be seen. Constriction of the aorta is there. And poor breast development, poor secondary changes can be there. Ovaries, for example, are rudimentary, which we call as streak ovaries. And there is no menstrual cycle as such. So this is a good set of it along with it. There can be some multiple nevi seen on the skin also. So this can be asked as a set of MCQs, so you people can educate yourself on it. Perhaps what is missing can be a lymphedema. For example, there can be a lymphedema in the neck or in the foot. Hypoplastic nails have been mentioned. This is called, the elbow deformity is called the increased carrying angle. Webbing of the neck, that is the increased fold over here. Coarctation of the aorta, otherwise the constriction. There can be congenital anomalies in the kidney and the ureter, dual ureter and the horseshoe kidney. Renal and the liver functions are also affected. So this will be the complete set of features for the Turner's syndrome. This is a karyotype. Karyotype means you arrest the chromosome or the cell division at one particular stage and the chromosomes are getting separated. Then they are arranged numerically. Each one has got a nomenclature and then finally this is being picturized. This can be sent to any part of the world wherein you can get a secondary opinion. Also, if you observe very carefully, each of the chromosome has got a dark and a light line, which is called a G banding or the GMSA banding. I shall come to the structure of the chromosome later on. Anyway, this is a normal karyotype that is there. Now, what happens in a case of Turner's syndrome? 45X0. So, in this one, I find that there are two X chromosomes, wherein here there is a single X chromosome, and that is because of the non-discharge, failure to separate. So, you find that is not brought over here. There is a defect in the X chromosome. The topics or the features I have already mentioned. So here are some of the features such as hypothyroidism, widening of the chest, infertility, short and wide neck, etc. Some are given. Now I would like you people, it's a kindergarten question, kindly enlist the missing components in this picture. If you cannot, go back to the original picture. So there can be a shortening of the metacarpal that is seen in this picture. Also, there can be some renal disorders. As in this case, you find that there are two kidneys on either side normally, but here they are fused together to form what is called the horseshoe kidney. Also, the ureters also can be duplicated. Therefore, on one side, I find two ureters. This is a cardiovascular abnormality. After the arch of the aorta, and I find that there is a constriction over here, which is called the coarctation of the aorta. Coarctation of the aorta, one of the common conditions shall be Turner's syndrome. Also, I find that there can be the bicuspid aortic valve. So, this is a normal valve and this is a bicuspid valve that is seen over here. There can be a distension or a dilatation of the aorta. And I find that there is a dissection of the aorta also that takes place. So, there is a bicuspid valve, there is a distension, there is a dissection of the aorta as well as a coarctation. So, these are the abnormalities which you people shall remember. Coming back to the female genital system, you find that there is a maldevelopment over here. This is a uterus that I can see, and this is probably the broad ligament. These are the sets of the fallopian tubes, and at the end I should see the ovaries. But here, what happens is the ovaries are quite small, and they are called as streak ovaries, which are non-functional. Therefore, this is a gonadal dysgenesis, thanks to Webb-Path. Now, what are the abnormalities that can be identified in the childhood, in adolescence, and in adulthood? In childhood, you find that there can be a short stature, cardiovascular malformation will be there, renal diseases, otitis media, and others. But as the child grows into adolescence, you find the gonadal dysfunction, amenorrhea, can be brought into picture. And when the child becomes an adult, there is an obvious infertility, weakening of the bones or osteoporosis, hypothyroidism, hypertension, dyslipidemia, sometimes diabetes. And paradoxically, there can be a gonadal tumor also. All these are certain features of the Turner's syndrome. And I would like you people to mention it either as the manifestations or the complications of the Turner's syndrome. Thanks to Frontiers in Pediatrics for this wonderful thing which you people can draw. So, what is the approach for it? How do you approach a patient with a Turner's syndrome or their family? First, we must not give false assurances. There is no cure as such. However, hormonal treatment can be given so as to improve the growth. Estrogen for the development of the breast, at least cosmetically. And it is usually an incidental finding, but if there is a family history, an amniocentesis or a chorionic villus biopsy can be performed to make an early diagnosis. Karyotyping, as I told you earlier and shown you in the pictures, can be done. There is something called as a biobank in which we will be able to study the genetic material. Prenatal testing by means of these will be mandatory, and it can be the decision of the pediatrician and the parents whether to continue with the pregnancy or not. Now, to remember what can be a mnemonic for the features of Turner syndrome. Thanks to medicine mnemonics, pediatrics for USMLE. And this is the reference over here. Can Turner contest the election? So election is the key word over here. Now, what is this election? Let us see. E stands for eye problems, which can be ptosis, cataract, etc. Ear infections, again. L for lymphedema, low hairline, liver disorders. E again for elbow deformity or cubitus valgus. C for cardiac abnormalities such as bicuspid aortic valve or coarctation. T for thyroid disorders, hypothyroidism. I, increased weight and blood pressure, hypertension. O for ovarian dysgenesis, amenorrhea, infertility. N for wide spacing of the nipple, and the neck is also webbed. I think it is a good set of mnemonics, easy for you students to kindly memorize. So, my dear students, what do you feel this one is? Dear chromosome, I missed you. Thank you for your patient listening.